Hello everyone. In today's video, we are going to discuss about the contraceptive methods in the chapter Demography and Family Planning. The objectives of today's session is to understand the classification of the various contraceptive methods. What is contraception? Contraception is a mechanism. This mechanism is intended. What is the function or the role of this mechanism? What is the role of this contraception? It is a mechanism which is intended to reduce the likelihood of, to reduce or to prevent the fertilization of an ovum with a spermatozoon. So we see that what does this contraception do? It acts as a barrier. It prevents the fertilization of the ovum. It prevents the fertilization of the ovum with the spermatozoon. So that is nothing but the contraception. What is conventional contraception? Conventional contraceptives are the methods that require the action at the time of sexual intercourse. For instance, we see that any contraception which is used at the time of sexual intercourse is the conventional contraceptives. We have condoms, the spermicide and the jelly, etc., which is used at the time of sexual intercourse is conventional contraceptive. Moving on, we have cafeteria choice. What is cafeteria choice? Why do they mention the word cafeteria here? When we go to cafeteria, they provide us a menu. In this menu, we have a choice to select what we want to order or what we want to similarly what we want to eat. Similarly, in cafeteria choice with regards to contraceptive, a menu or the methods, all the methods of contraception will be provided to the individual, and this individual has a choice to make which contraception they want to practice. To offer all the methods of the contraceptives from which an individual can choose according to his or her need, according to their need, her need or his need, they get a choice to select which they want. Okay. So this is cafeteria choice. You can see all the methods of contraception are explained to the individual. Their advantages, the effectiveness, the drawbacks, all of those will be explained to the individual and they make a choice. So cafeteria choice. Moving on to the classification of the devices, contraceptive devices, we have two. The contraceptive methods are broadly classified into two groups. We have spacing methods and the terminal method. Spacing method is a temporary method which is used to space the children. If the couple wants the kid in the second year of their marriage and then give a gap for 3 years and then have their second baby, during the gap of 3 years, the method which is used is the spacing method or the temporary methods, whereas the terminal methods are permanent, irreversible methods. In these terminal methods, it is usually followed by the couples who have acquired their desired family size. Once their family size has been, completed, they go for permanent sterilization, permanent method like that of the terminal method. Let us understand the subclassification of these. Under the spacing methods, we have barrier methods. Barrier could be physical, chemical or combined. We'll be dealing in the next upcoming slide. We have intrauterine devices, hormonal methods, post-conceptional method and miscellaneous. So what are this? And terminal, we have sterilization, which is male and female. Let us see, guys. So the methods are classified into two. We have spacing method, and then on the other hand we have the second one is the terminal methods. In the spacing method, we have barrier method. In the barrier, we have physical, chemical combined, intrauterine contraceptive devices, IUDs, hormonal methods, post-conceptional method. Next, what do we have? Post-conceptional method. Barrier, IUD, hormonal, post-conceptional. And the last one is miscellaneous, where we have various methods like calendar method, cervical mucus, like abstinence, and all those of things will come. Miscellaneous, which we'll deal later in detail. And then the second half we have terminal methods. Under the terminal methods we have male sterilization, which is vasectomy, and female sterilization known as tubectomy. I hope it's clear the classification. You can just have a look at the pictures here. Under the miscellaneous we have withdrawal method, calendar method. Under the terminal methods there is sterilization, tubectomy, copper T, that is IUDs, and then we have diaphragm, condoms, spermicides, the sponge and cervical caps. We'll deal of each of them. For now, for this picture I'm just telling you to have an idea about this spacing method and terminal method. We have this classification. Moving on to the first method, that is spacing method. In the spacing method we saw the first one, that is barrier method. Barriers, we have physical method and the chemical method. Under the physical method we have condoms. The condoms are of two. We have male condoms as well as the female condoms. And the second one is diaphragm. Diaphragm, also known as Dutch cap. This diaphragm is a vaginal barrier. It was invented by a German physician, so it is also known as Dutch cap. Okay, the Dutch cap diaphragm. Then we have vaginal sponge, which is popularly known as with the brand today. Okay, this vaginal sponge, it has been employed for hundreds of years. They soak the sponge in vinegar or in olive oil, and then today commercially it has been marketed with the trade name of Today. Okay, this is used to prevent the contraception. It is used to prevent the conception. And then we have chemical methods. Under the chemical methods, we have the foams, creams, jellies, paste, suppositories, and soluble films. I hope it's clear. Foams, creams, jellies, and paste, suppositories, and soluble films. Let us look at the pictures. Under the barrier methods, we have condoms, male and female. Then we have the diaphragm, and then this is a sponge, popularly with the trade name Today. And then we have under the chemical methods, the spermicide, jellies, paste, foams, and the suppositories are given. Moving on, we have the second one, that is intrauterine devices or IUDs. Under intrauterine devices, remember there are three generations of IUDs. In the first generation, they are non-medicated or inert. The non-medicated or inert IUDs are known as first generation IUDs. Whereas the medicated or bioactive IUDs are the second generation IUDs. The non-medicated is first, medicated is second. The third one is hormone releasing, is the third generation. So let us see. Under the intrauterine devices, we have three classification. Mainly two. The broad classification is two. IUDs, they are broadly classified under two. We have non-medicated and medicated. Now, under the non-medicated, we have two names, that is Lippes loop and Grafenberg's ring. We have two, Lippes loop and Grafenberg's ring. Under the medicated, they are further classified into, medicated is classified into second generation and third generation. We have second generation and third generation. Second generation are the metal ions, the copper releasing. We have the second generation, we have copper releasing, Cu, copper releasing. Second generation, copper releasing. And the third generation, we have hormones. Clear, guys? Let us make the classification again. IUDs, we have two broad classifications, non-medicated and medicated. Under non-medicated, Lippes loop and Grafenberg's ring. Forget about it. Now medicated. Moving on to medicated, we have metal ions. Okay, metal ions and hormone releasing. The generation wise, non-medicated is belonging to first generation, medicated is belonging to the second generation, Under the medicated, the second generation and third generation both come because it has two classifications. The second generation is the copper releasing and the third generation is the hormone releasing. So we are clear with the generations and the classification. Now let us see the examples. Now the first one, non-medicated, also known as inert or first generation, we have Lippi's loop and Grafenberg's ring. Under the medicated, we have metal ions, that is copper releasing, second generation. Now why did they start using this copper? In the second generation, a new approach was added by adding the copper to the IUDs. A new approach was made wherein they started adding the copper to the intrauterine devices. Initially it was non-medicated. Later on copper was added to the IUD. It is because this copper has a very strong anti-fertility effect. It has a anti-fertility effect in it. Then this addition of this copper also made this IUDs to fit very easily. Even in the nulliparous women, this could be used. The smaller devices were formed by the addition of the copper. The earlier devices were the copper 7 and copper T200. So now under the second generation, we have earlier devices and newer devices. Again, there is a classification. IUDs, non-medicated and medicated. Under medicated, we are studying about the metal ion, dealing with copper. Later we'll go to hormones. Under copper, there is a classification, earlier device and the late device. What is this earlier devices? The earlier devices are copper 7. So we have copper 7 and copper T200. So remember, under the earlier devices, we have copper 7 and copper T200. The newer devices, the classification earlier and newer. Classification earlier devices and the newer devices. Under the earlier devices, copper 7 and copper T200. Under the newer devices, there are variants of the T device. The variants of T device are copper T220 and copper T380. 220 and 380. Now what does this B and A stand for? There are symbols like B and A, copper T200, copper 220 and copper T380. B is for the size and A refers to the Ag of the silver and Au of the gold. We know Ag is a symbol for silver and we have Au for gold. So these symbols indicate that. And now we are done with the metal ions, the earlier devices and the newer, the first variant of T device. So the values guys, 7 and 200. Under the newer devices we have 280, 220 and 380. 220 and 380. Next, Nova T. It contains the silver core. Very important. Remember, Nova T contains silver core. Multi-load device. Third, we have multi-load device. In multi-load devices, we have two, multi-load copper 250 and multi-load copper 375. So, we see that 7 and 200 earlier devices. In the newer devices, we have copper T220 and copper T380. Nova T contains silver core. Simple. Multi-load devices. This is copper T. And now multi-load devices, we have 250. Multi-load copper 250. 220 and this is 250. And this is 375. Copper multi-load copper 375. Clear guys? This values, remember, 7 and 200. We have 220 and 380, 250 and 375. Here plus, here minus. Here minus 5 and here plus 30. So we are done with this. So now we see that the hormone releasing. In the hormone releasing, which is progesterones, which is of the third generation, we have two things, that is progestasert and LNG20, or also known as Mirena. We have progestate and Mirena or LNG20. levonorgestrel 20. So we see this intrauterine devices. This is hormone releasing and copper-T. It is fitted like this. Okay. So we are done with the IUDs. Moving on to the hormonal methods. Under the hormonal methods, we have oral pills, depot, that is slow releasing formulation. Two divisions are there. Under the hormonal, we have oral pills and depot. Starting with the oral pills, we have either combined pills or progesterone only pill. Remember two things together, combined or progesterone only. Combined pill or progesterone only pill. Then we have postcoital pill. Postcoital pill. The postcoital pills, we have IUDs and hormonal under it. And then we have once a month pill. There is once a month pill. A male pill known as Gossipol is also available. So I hope it's clear. Combined pill, progesterone only pill, once a month pill, male pill. Once a month, male, progesterone only, combined. The last one is postcoital pill. You can remember this way. All these four you can mention and then write about the postcoital pill, which is IUDs and hormonal available. Moving on to the second half, that is depot, which is a slow release formulation. Under the depots, we have injectables, that is injections, progesterone only, and DMPA and NET-EN are the two progesterone only injections, or we have combined like cyclophem, cycloprovira and mesigna. Subdermal implants, we have Norplant and Norplant R2. Under the depots, we also have the vaginal rings. So I hope it's clear. This is about the hormonal methods. Under hormonal methods, we have oral pills and depots or slow releasing formulations. Regarding this depot and all of these, will be dealing in detail. Okay, this hormonal contraceptives, which is the most effective spacing method of contraception. It is 100% effective, guys. This is highly recommended by the gynecologist all over. So because it has 100% effectiveness in preventing the pregnancies, we'll deal about all of these in detail regarding each of the pills and the injectables, the implants, like we saw the subdermal implants like the subcutaneous implants, Norplant and Norplant R2. All of these will deal in detail in the upcoming video, in the next video. For now, you always remember that it is a very important spacing method which is having 100% effectiveness, and the full forms of these also will be dealt later on. Progesterone only pill, we call it as POP. Okay, and then we have progesterone only pills and levonorgestrel, LNG and DMPA, and we have NET-EN. So after all of these, we move on to the next contraceptive method, that is post-conceptional method. In the post-conceptional method, we have menstrual regulation, menstrual induction and oral abortification. In the menstrual regulation and induction, what do? Or we abort the baby. We aspirate the endometrial cavity within the 14 days of the missed period in the women, and the aspiration of the contents of the endometrial cavity is done in the menstrual induction. You can see here. They regulate the menses by giving the injections, and also they regulate the menses by giving the pills, and the induction is done wherein they aspirate the endometrial cavity, the contents of the endometrial cavity within the 14 days of the missed period. And then we also have the oral abortificants. Moving on to the miscellaneous methods. Under the miscellaneous methods, that is abstinence, that is to avoid the sexual intercourse, and we have coitus interruptus, where the male prevents the ejaculation into the vagina. And then we have safe period, which is the rhythm method or calendar method. We have here safe period, which is rhythm method or calendar method, which is practiced. And then we also have the natural family planning methods like the basal body temperature, cervical mucus method, and symptothermic method. All of these will deal in detail. For now, remember under the classification, the names you have to remember: the natural family planning, basal body temperature, mucus, cervical mucus, and symptothermic method. Breastfeeding, lactational amenorrhea, which plays indirectly a role in preventing the pregnancy. The birth control vaccine, which is also considered as a miscellaneous method to prevent the fertilization, which acts as a contraceptive. So I hope the miscellaneous methods are clear: abstinence, coitus interruptus, safe period, natural family planning method, and breastfeeding and birth control. Moving on to the second method, the permanent method, which is terminal method, under which we have male sterilization, vasectomy. We can see in vasectomy a part of vas deferens is cut and the cuttings will be sealed. A small incision will be made and a small part of the vas deferens will be cut and it will be sealed. The female sterilization tubectomy, where we have laparotomy or mini laparotomy. In mini laparotomy, it will be kind of less invasive. A small incision will be made at the time of birth or soon after the childbirth, and they perform this tubectomy where they clamp it and cut and seal it off. Whereas in the laparoscopic sterilization of tubectomy, under laparoscopic, it can be performed at any time. Not necessarily it has to be done at the time or during the time of the childbirth or soon after it. It can be performed at any time, and comparatively large incision will be made in cases of laparotomy because it is difficult to locate the fallopian tubes. Thank you. With this, we come to an end of the classification of the contraceptive methods. The details will be dealt in the next video. I hope everything is clear, and if you like the video, hit the like button and subscribe.